Of course, the patient needs to really believe that they can do better, right? That they can go beyond. You know, if you want 10 veneers because you want to look better, and then your biological dentist says no, but you know you are allergic to this, and you have a lot of that stuff in your mouth, and you have this problem, you know, that is showing up on your blood test, that is not allowing you to sleep better, and you have this problem with your nutrition that is not allowing you to perform better. Yes, I can do the 10 veneers and you're going to look a little bit better, but if we take care of all the other stuff, you're going to look much better, and it's looking better from inside out. You know, you're going to smile with much more power, and you're going to use these veneers in a much better way. You know, you're going to impress people in a much deeper way when you're happy from inside, when you feel better from inside, and when you're really on a different level in terms of performance. So
Yes.
What do you think are the main, if you can give one or two or three examples of things that dentists are missing the opportunity, you know, by not looking into this, you know, common things that we are doing in dentistry that may cause harm, or that are overlooked, that we should pay attention? If you give just a few examples for people to understand, you know, how much deeper dentistry can be.
Yes. So as I said, the mouth is the entrance to your overall body. It's kind of like the entrance to your gut system. Everybody is talking about gut health. Yeah? Have you heard about leaky gut and chronic inflammation there? And for everybody, gut starts here. But actually, your digestion and your gut starts in your mouth, and you cannot imagine how diversified your microbiome is there and how much changes will be there due to nutrition, but also, very important, due to things that have been installed by conventional dentistry with one purpose: fixing bites and smiles. Yeah. And the common triggers that stress people nowadays epigenetically, you have to know how stress works, but I can go down deeper later, is any metal nowadays. Metals have three inherent challenges. They can become an immunological problem, yeah, because your body just reacts to it. It's nothing that should be in your body. It can be toxicological problem, so just toxic. For example, mercury from amalgam fillings. Everybody knows already that this is the most toxic non-radioactive element known to man. Shouldn't be in your body. And the third component is the electric component. You know about oral galvanism, batteries, you know about corrosion. But what you maybe not know is that if you live in an environment that is loaded with EMF, electromagnetic fields, like 3G, 4G, 5G, all these waves here on this one, etc. Any metal overall in your body will amplify these frequencies and change your whole body electric. It's known that EMFs are it's carcinogenic since 2019, and they know exactly how it works. Nobody knows about it. And of course, there are studies showing that, for example, if you do a phone call and having amalgam fillings, you get way more mercury vapor from the call, from the frequencies, like out of the filling, for example. Or if you have just a piercing here, it just gets amplified, and just, let's say, it can disrupt your whole nervous system because your body is electric in itself. So these are metal problems. We all call these the concept is called oral interference. It's a little bit of a weird name, but in acupuncture and neurotherapy, it's medical. We call it neuromodulative triggers. What triggers your whole nervous system through an inflammation, an ongoing chronic inflammation, through cytokines, through whatever, in your mouth, on your trigeminus, 24/7. And it could be a root canal, it could be a titanium implant, it can be any metal, it could also be a composite or like an adhesive that you may be allergic to. So you really have to understand how everything connects in the overall body.